Welcome to Situational Awareness, First Aid Response Training. In this training, you will learn how to assess a scene, recognize potential medical emergencies, and understand different response measures. This course is not designed as certification level training. You are not required to provide first aid response on behalf of the county as part of your position. Response to medical emergencies are voluntary and protected under the Good Samaritan Law. Let's review how to assess the scene. When assessing the scene, first look at the area. Remain calm and scan the surroundings. Check the safety of the area and look for possible threats. Unsafe situations could be fire, electric lines, smoke, traffic, violent behaviors, hostile crowds, chemicals, falling rocks, etc. If the area is not safe, stay in place and call 911. Never put yourself at risk. If there are bystanders, encourage them to assist. Determine the number of victims in the area and try to determine what happened. Next, you will assess the victim. Continually check your scene as you approach the person. If the scene becomes unsafe, leave immediately. Visually check the victim and talk to them with a reassuring tone. If the person is conscious, ask them questions such as, "What's your name? Can you tell me what happened? May I call 911? Asking questions helps you determine the victim's sense of awareness. If the victim is unconscious, tap them on the shoulder and ask if they are okay. If there is no response, call 911. You may check the victim's breathing and pulse, control bleeding if necessary, or render any other first aid CPR measures. Now let's look at a variety of emergency situations. We'll cover the symptoms and response measures for each. It's important to remember that everyone is different. All symptoms may not be present and may vary from person to person. In any medical situation, calling 911 is the best response. Cardiac event. The symptoms of a cardiac event include chest discomfort in the center of the chest that lasts a few minutes or comes and goes. This discomfort is an uncomfortable pressure, squeezing, fullness, or pain. Discomfort in other areas, such as one or both arms, the back, neck, jaw, or stomach. Shortness of breath, with or without chest discomfort. Other signs may include cold sweat, nausea, or lightheadedness. If you suspect a cardiac event, act fast. Minutes count. Call 911 immediately. If you have access to an AED, automatic external defibrillator, use it. Perform CPR. Here is a video on how to perform CPR. This video was shot in Britain, so it refers to calling 999. Our emergency call is 911.
My name is Vinnie Jones, and I'm going to teach you a lesson you'll never forget. There are times in life when being tough comes in handy. Say some geezer collapses in front of you. What do? We need a volunteer that ain't breathing. Here's one I made earlier. First thing you do is you check him over. If he ain't responsive or he ain't breathing, or he's making noises like this, then his heart will stop working, he's having a cardiac arrest. Look lively. First call 999. Then you do hands-only CPR, and no kissing. You only kiss your missus on the lips. Watch. Lock your fingers together, knuckles up. Then push down, right on the sovereign. Push down 5 or 6 centimetres. That's about 2 inches in old money. Push hard and fast, about 2 times a second, like to the beat of staying alive. Worried you'll hurt him? Better a cracked rib than him kicking the bucket. Keep this up till the ambulance arrives. So don't forget, check him over. Call 999, push hard and fast to staying alive. It works. Hands only CPR. It ain't as hard as it looks.
Stroke. The symptoms of a stroke are sudden and include numbness or weakness of face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding, trouble seeing in one or both eyes, Problems walking, dizziness, loss of balance and coordination, severe headache with no known cause. If you suspect a stroke, act fast. F is for face. Ask the person to smile. Does one side droop? A is for arms. Ask the person to raise both arms. Does one arm drift downward? S is for speech. Ask the person to repeat a phrase. Is their speech slurred or strange? T is for time. If you observe any of these signs, call 911 immediately. Stay with the person so they are not alone. Provide comfort until EMS arrives. Monitor the victim for any change. Call 911 if the person's condition changes, such as they pass out or stop breathing. Choking. The symptoms of choking include coughing or gagging, hand signals such as pointing at the throat, inability to talk or respond to questions, clutching the throat with a hand, which is considered the universal sign, wheezing, fainting, face, lips, or fingernails beginning to turn blue. If a person is choking, call 911 or get a bystander to call. If there is a partial obstruction, the person is still getting air and able to cough. Stay with the person, encourage them to continue coughing. If there is a complete obstruction, the person will not be able to breathe. Begin abdominal thrust immediately. The following video demonstrates how to perform abdominal thrust.
So what do you do when someone's choking? Say you and a friend are out in a restaurant and all of a sudden they start choking. So I'm going to have my friend Hannah come over here. And we're out, we're having a good time, we're eating, and all of a sudden she seems like she's choking. First you ask, are you okay? And oftentimes the international sign for choking is this, okay? They're like, I can't breathe, something's going on. If you're around other people, you want to get them to help you. You want to, if you're in a restaurant or a place of business, have someone call out for help and have the people help you out. Tell them what you're doing. Don't just attack them because that will just heighten their anxiety and their panic. So what you're going to do is you're going to stand behind them and you're going to wrap your arms all the way around, okay? And you want to you find their belly button with your pinky, make a fist, put the pinky on the belly button, then roll it up so your thumb is, the knuckle of your thumb is right there, and then you thrust, you pull it in and up, and I'm not going to do it as hard. In and up until they can dislodge what is in there and they can breathe again. Don't go crazy like in the movies and start slapping their back and like wrestling. Sometimes people get carried away and they want to slap your back and they just end up hurting you. If the person is pregnant or a larger person and you can't get your arms all the way around to where their belly button is, you're going to want to go higher up to where their breastbone is. So say Hannah is pregnant, congratulations. You wrap around, you find their breastbone, and then you just do the same thing, in and up until they dislodge whatever is in their throat and they can breathe again. If the person is so big, if you're a small person and you have a big strapping person with you who's choking and you just can't even do that, you can assist them into doing a self-Heimlich maneuver on a chair or a surface that will get to their diaphragm. You just lean them over and kind of talk them through it. Stay calm. The more panicky you get, the more panicky they're going to get. They're already in a state of anxiety because they can't breathe, which is normal. So if they lose consciousness and they fall to the floor, you're going to lay them down, you're going to roll them over, and then you're same thing. You're going to find the belly button, roll up, and you're going to thrust while they're on the floor until that comes out or until help arrives. Continue trying to do the thrusts and trying to get them to get that out of their throat so they can breathe again, and just stay with them until help arrives.
Seizures. There are many causes to seizures and many varying symptoms. Some include a person may feel, see, or hear things that are not actually there, muscle spasms, which may appear as body stiffness, jerks, or shakes. These can create breathing problems, or the person may bite the cheek or tongue. The person may black out, lose consciousness, and fall. Muscles may tense or go limp. This may occur in the arms, legs, or trunk. It may cause the person to lose balance or drop items. The eyes may roll back, or the person may just blankly stare. If it appears a person is having a seizure, stay with the person and monitor their condition for changes. Remain calm. Most seizures only last a few minutes. Call 911. Keep the person comfortable and remove any items to prevent injury. If the person is wandering, help steer them clear of danger. Anaphylactic reaction. Anaphylaxis is a severe life-threatening allergic reaction. This reaction may start with typical allergy reactions such as itching, rash, hives, coughing, runny nose, or sneezing. More serious signs can develop quickly. Serious reactions include trouble breathing, swollen lips or tongue, trouble swallowing, tightness in the chest or throat, weak pulse, vomiting, diarrhea, or cramps. Call 911 immediately. Ask the person if they have an EpiPen or observe their actions. They could be trying to get to their EpiPen. Offer to help with the injection. Remain calm. Stay with the person and monitor their condition. Do not give the person anything to eat or drink. Loosen tight clothing. If the person stops breathing, perform CPR. This next video demonstrates how to properly use an EpiPen.
Epi equals 911. If you get it, call it. Take the EpiPen out of its case. Hold it in a firm fist grip. Remove the cap. Make sure the child is sitting or lying down. Identify the big muscle in the thigh. Hold the leg and the child steadily. Press the orange part firmly against the thigh so that it clicks. Stay there. Don't bounce. Hold for 10 seconds. Press, click, and hold.
Bleeding. Severe bleeding situations are blood that spurts, abdomen and chest wounds, and continuous bleeding for more than 10 minutes. When faced with a bleeding emergency, remember universal precautions. This means we should treat all bodily fluids as if it is infectious. Avoid contact with blood or fluids from another person. Call 911 immediately, then provide assistance. If possible, have the victim apply direct pressure to the wound. If assisting, make sure you wear gloves or cover the area with a non-porous, non-absorbent barrier. Direct pressure is simply applying firm pressure on the wound. For injuries to the arm, elevate the arm above the heart. For leg injuries, have the person lie down and elevate the leg. If direct pressure isn't working, try a pressure point. Pressure points are specific locations on the body where you press the artery against the bone to slow blood flow. In the arm, the pressure point is located in the upper arm between the two muscles. Use flat fingers to apply pressure. In the leg, the pressure point is located middle-bottom crease of the groin area. Think bikini line. Use the heel of your hand to apply pressure. For the lower leg, the pressure point is located back of the knee, directly behind the kneecap. Use your thumb to apply pressure. In all cases, you will know you're in the right spot because you can feel the pulse. Heat stroke. The symptoms of heat stroke include throbbing headache, lack of sweating, red, hot, dry skin, nausea and vomiting, rapid heartbeat, rapid, shallow breathing, dizziness, confusion and staggering, seizure, or unconsciousness. If you think a person is having a heat stroke, call 911 immediately. Move the person to an air-conditioned area if possible, or at least to a cool, shaded area. Remove or loosen restrictive clothing. If possible, place ice packs to the armpit, groin, neck, and back areas. Fan air over the victim. Monitor the person until EMS arrives. Let's talk about calling 911. When calling 911, stay calm. When you remain calm, you are better able to communicate information and receive instructions from the telecommunicator. Telecommunicators follow a specific questioning process. Allow them to walk you through the questions. Be prepared to give your location. If you don't know the address, describe your location as best possible. If you get disconnected, at least the telecommunicator knows where to send help. You will be asked your phone number. This is needed information in case you are disconnected. If you don't know the number or you are using someone else's phone, try to find it out. You will be asked your name. This is helpful to first responders in case they need more information once arriving on scene. You will be asked to describe what happened. Be specific. For example, I think it's a stroke. The victim isn't breathing. Listen carefully to the telecommunicator and do exactly as asked. Remember, the telecommunicator is in the process or has already dispatched help while still gathering information from you. Don't hang up until the telecommunicator tells you it's okay to do so. Let's review some additional response measures. You may need to determine if an unconscious person is breathing. Visually look for the rise and fall of the person's chest. If the breathing is very shallow, this may not be obvious. Place your ear into the victim's mouth and listen for breath sounds. Feel for the breath against your cheek. Recovery is a safe position for an unconscious breathing victim. Do not attempt to place a person in recovery if you suspect they have a neck or back injury. To place a person in recovery, position yourself beside the victim. You will be working with the arm and leg on the opposite side. Place the arm closest to you in an L-shaped position. Take the opposite arm, bending the elbow, and place the hand at the chin. Take the opposite leg and bend at the knee. Grab the opposite hip and shoulder and roll the victim toward you. Ice is a basic first aid treatment for sprains, strains, and bruises. Apply ice packs to the area to cool the tissue and reduce pain, swelling, and bleeding. Apply ice packs for 20 minutes every 2 hours during the first 48 hours. If you have questions, please speak with your supervisor. Also, follow up with your supervisor for any internal protocols that you are to follow in emergency situations. Thanks for your participation.